Look down at your legs right now. If you see those twisted rope-like veins pushing up against the skin, blue, purple, sometimes painful, sometimes just sitting there getting worse year after year, you've probably been told the same thing every single time you brought it up. Poor circulation, genetics, standing too long, sitting too much, compression stockings, maybe surgery. And if you've tried any of it, you already know the truth. It comes back, sometimes in the same spot, sometimes somewhere new. Because nobody, and I mean nobody, in a standard medical office is telling you what is actually happening inside that vein, what is actually failing, and more importantly, what created that failure in the first place. Here is the thing that will change everything you thought you knew about this condition. Varicose veins are not a circulation problem. They never were. Circulation is what you see after the damage is done. What you're actually looking at, those bulging, aching, embarrassing veins, is a structural failure. A collapse of a system that should have been supported by specific nutrients your body has been running dangerously low on for years, possibly decades. And once I show you the mechanism, the actual documented biological reason this happens, the solution is going to become obvious in a way that no compression stocking ever could. Let's start with some basic anatomy, because this is where everything changes. Your veins have a job that your arteries do not. Arteries carry blood away from the heart, they've got the pump behind them, so pressure isn't the problem. But veins carry blood back up toward the heart, back up against gravity. Every time you're standing, every time you're sitting in a car or at a kitchen table, your leg veins are fighting gravity to push blood all the way back up to your heart. And the way they do it, the engineering solution your body built for this, is one-way valves. Tiny, incredibly precise little flaps of tissue built directly into the inner wall of the vein. Every few inches, another valve. When the blood moves up, the valve opens. The moment blood tries to fall back down, the valve snaps shut. It's a relay race, station by station. Up and up and up. Now here's the question nobody asks. What are those valves made of? Collagen, elastin, connective tissue protein, the same material that holds your skin together, keeps your tendons strong, maintains the structure of your joints. And when those valves are healthy, this system is remarkable. 17,000 liters of blood move through your body every single day without you thinking about it once. The valves open and close around 100,000 times per day in your legs alone. But when those valves start to weaken, when the tissue they're made from starts to break down, the valve doesn't fully close anymore. Blood starts to slip backward. It pools in the section of vein below. That section begins to stretch. The vein wall, also made of collagen and elastin, starts to deform under the pressure. It bulges, it twists, it rises toward the surface of the skin. That is a varicose vein. Not poor circulation, a broken valve. A valve made of collagen that your body no longer had the raw materials to maintain. So now the question becomes, what destroys collagen in a vein valve? And this is where things get uncomfortable, because the answer is something 41% of American women, over 50 and 23% of men, have been exposed to for 30, 40, sometimes 50 consecutive years, and nobody connected it to the veins in their legs. Chronic, low-grade inflammation. Every time you eat something that spikes your blood sugar, and I'm not talking about obvious candy or soda, I'm talking about the bread, the pasta, the crackers, the healthy granola bar, your body goes through a process called glycation. Sugar molecules attached to protein fibers, including collagen. The technical term is advanced glycation end products, AGEs. And what AGEs do to collagen is almost exactly what heat does to a rubber band. It stiffens it, it cracks it, it makes it brittle and inflexible. A valve that should be soft and responsive becomes rigid and gapped. It no longer seals properly. Blood begins to pool. On top of that, the modern American diet is saturated with omega, 6 fatty acids primarily from refined seed oils, soybean oil, canola oil, corn oil. These oils are in nearly every processed food in your grocery store. And in excess, and what we're consuming is 25 to 30 times excess, they directly fuel the inflammatory pathways that accelerate collagen degradation. A 2021 analysis published in the journal Nutrients found that chronic low-grade vascular inflammation was present in 84% of chronic venous insufficiency cases. That's the clinical name for what eventually becomes varicose veins. 84%, not a coincidence. An inflammation epidemic showing up on your legs. Now here's the part that almost no physician will ever bring up in a standard appointment. Collagen synthesis, the process of building and repairing collagen, requires one thing above everything else, a cofactor without which the entire process simply does not happen, and it is not protein. It is not zinc. It is not any supplement that typically comes to mind. It is vitamin C. Specifically, vitamin C is required for an enzyme reaction called hydroxylation, the step that turns raw proline and lysine amino acids into the stabilized triple helix structure that gives collagen its tensile strength. Without enough vitamin C, your body can technically start making collagen, but it assembles incorrectly. The strands don't cross-link properly. The structure is weak. It tears under pressure. And the pressure inside a leg vein, especially in someone who stands for hours, or who is carrying extra weight, or who is postmenopausal, is not small. What makes this worse is that vitamin C is one of the most rapidly depleted nutrients in the modern body. Stress burns through it. Smoking destroys it. Alcohol depletes it. Chronic inflammation consumes it. If you are dealing with any of those conditions, and most Americans over 60 are dealing with at least two of them simultaneously, your vitamin C status is almost certainly lower than any blood test is designed to catch. Because here's what your doctor tests: serum vitamin C, the amount floating in your blood. But the tissue level vitamin C, the amount actually available inside your connective tissue, your vein walls, your valve leaflets, is a completely different number. You can have blood levels that read as normal while your vein walls are quietly running on empty. And nobody checks for that. There's a second layer to this that even functional medicine practitioners frequently miss. In nature, vitamin C doesn't travel alone. In a whole food, an orange, a bell pepper, a kiwi, vitamin C is bound to a family of compounds called bioflavonoids: rutin, quercetin, hesperidin, diosmin. These bioflavonoids do something that isolated ascorbic acid cannot do by itself. They directly strengthen the vein wall. They reduce capillary permeability, meaning they stop the vein wall from leaking fluid into surrounding tissue, which is what causes the swelling, the aching, the heaviness in the legs at the end of the day. They reduce the activity of specific inflammatory enzymes that break down the connective tissue in the vein wall. A Cochrane review, one of the highest standards of evidence in medicine, evaluated 53 separate randomized controlled trials on a specific bioflavonoid compound called diosmin and hesperidin, which together are used as a standard pharmaceutical treatment in France, Italy, and 23 other countries for chronic venous insufficiency. The results showed significant reduction in leg swelling, pain, heaviness, and skin changes associated with vein damage. It is a drug. It is prescribed in Europe. In the United States, we hand out compression stockings and tell people to elevate their feet. Rutin specifically found in buckwheat, elderberries, and certain citrus peels has been shown in multiple peer-reviewed studies to inhibit an enzyme called protein disulfide isomerase, which plays a role in the formation of blood clots inside damaged veins. A 2012 study published in the Journal of Clinical Investigation identified this pathway and called rutin a potent inhibitor of thrombosis in the context of venous disease. And horse chestnut seed extract, specifically the active compound called acin, has been evaluated in a 2012 Cochrane meta-analysis comparing it directly against compression stockings. The conclusion: horse chestnut extract was as effective as compression therapy for reducing leg volume and relieving chronic venous insufficiency symptoms. As effective as the first-line treatment your physician recommends, and it works from the inside out, not from the outside in. That research has existed for over a decade. There's one more element to this puzzle that ties everything together, and it goes to a mineral deficiency that is now present in an estimated 68% of Americans: magnesium. The smooth muscle cells that line your vein walls require magnesium to maintain their tone, their ability to contract and support blood flow upward. When magnesium is deficient, and deficiency doesn't show up on a standard blood test because less than 1% of your body's magnesium is in the blood, the vein wall loses its muscular integrity. It becomes flaccid. It cannot assist the valves in pushing blood upward. The whole mechanical system weakens at once. At the same time, low magnesium elevates baseline inflammation. It increases a protein called C-reactive protein, a direct inflammatory marker. And that inflammation accelerates the collagen breakdown we already talked about. Magnesium deficiency, collagen degradation, bioflavonoid depletion, glycation from refined carbohydrates, seed oil inflammation, each one running in the background, each one making the others worse. And the result of all of them running together for 20, 30 years is those veins you see in the mirror right now. Two more pieces, because they explain things. Standard medicine gets completely backwards. First, estrogen. Women develop varicose veins at roughly twice the rate of men. The conventional explanation is pregnancy, where the expanding uterus puts pressure on leg veins. And pregnancy absolutely contributes. But it doesn't explain why postmenopausal women no longer pregnant, no longer dealing with that pressure, continue developing new varicose veins at an accelerating rate after menopause. The real answer is that estrogen has a direct effect on vein wall tone. Specifically, estrogen receptors in vein smooth muscle cells affect how strongly those walls contract. During the reproductive years, estrogen helps maintain vein wall tension. As estrogen drops after menopause, that muscle tone decreases. The vein walls become more compliant, meaning more likely to stretch and deform under venous pressure. This is a direct hormonal contribution to vein wall failure that has nothing to do with circulation and everything to do with collagen and connective tissue maintenance. Second, intra-abdominal pressure, something that nobody connects to leg veins in standard practice, chronic constipation. When you strain, when stool sits in the colon for too long and creates buildup, you are raising the pressure inside your abdominal cavity. That pressure compresses the large veins that drain blood from the legs back to the heart. It creates back pressure that the leg vein valves have to work against every single time you stand up. Over years, this wears valves down mechanically, completely independent of diet or nutrition. And what causes chronic constipation? Dehydration, low magnesium, a diet stripped of whole food fiber and fermented foods, the same dietary environment that is destroying your collagen and depleting your bioflavonoids is also creating the pressure conditions that accelerate valve damage. Every single element of this comes back to the same source. When you walk into a vascular surgeon's office with varicose veins, here's what happens. They assess severity. They may order a duplex ultrasound to look at valve function. And then, depending on severity, they offer you one of three things: compression stockings, sclerotherapy, where they inject a chemical into the vein to scar it shut, or endovenous ablation, where they thread a laser or radiofrequency catheter into the vein and cauterize it from the inside out. These are not solutions, they are removals. They destroy the damaged vein. The blood finds another route, and in 6 months, sometimes 12, sometimes 2 years, the process starts again in an adjacent vein. Because the root cause, the collagen breakdown, the bioflavonoid deficiency, the inflammation, the structural deterioration that destroyed the first vein, is still running in the background, still destroying the next vein. The American College of Phlebology estimates that 20 to 30% of patients who undergo varicose vein procedures require repeat treatment within 5 years. The problem is not treated, the vein is eliminated. Entirely different things. Now let me give you what you actually came here for. What to do about this, not on the surface, but at the root. Step 1, eliminate the inflammatory fuel immediately. Remove refined seed oils from your diet. Soybean oil, canola oil, corn oil, sunflower oil, safflower oil, cottonseed oil. Read every label. These are in crackers, salad dressings, mayonnaise, chips, frozen meals, restaurant fryers. This is not a minor adjustment. The average American gets 80 grams of linoleic acid from seed oils per day when the metabolically safe amount is closer to 4. Replace them with butter, extra virgin olive oil, coconut oil, beef tallow. The inflammatory cascade that is degrading your vein collagen runs on seed oil. Stop feeding it. Step 2, restore your bioflavonoid levels through whole food. not an isolated vitamin C supplement. Whole citrus, and specifically the white pith, not just the juice, because that pith is loaded with hesperidin and rutin. Buckwheat, elderberries, red onions, dark cherries, dark berries. Eat the food, not the extract, as your primary source. The bioflavonoids need to arrive in the way nature packaged them, alongside the fiber and the polyphenols and the vitamin C itself. Step 3. Address vitamin C status properly. The RDA for vitamin C is 75 to 90 milligrams. That number was set to prevent scurvy, the most extreme deficiency state. For connective tissue repair in someone dealing with chronic vascular inflammation, the therapeutic range used in clinical research starts at 500 milligrams and in some studies goes to 1,000 milligrams per day. If you choose a supplement, look for one that contains whole food bioflavonoids in the same capsule, not isolated ascorbic acid alone. The difference in bioavailability and collagen synthesis outcomes is measurable. Step 4. Correct magnesium. Magnesium glycinate or magnesium malate, not magnesium oxide, which is poorly absorbed and will mostly give you loose stools. Start at 300 to 400 milligrams per day, taken in the evening. This also addresses the sleep disruption, the leg cramps at night, and the constipation that are all contributing to venous pressure and vein wall degradation simultaneously. Step 5. Eliminate the glycation sources. Refined carbohydrates, bread, pasta, crackers, cereals, anything made from flour are AGE generating machines inside your vascular tissue. You do not have to go to zero carbohydrate, but reducing refined carbs to under 50 grams per day for 90 days allows collagen synthesis to begin outpacing collagen destruction for the first time in possibly years. That is when you start to see real structural change, not cosmetically, but functionally. Valves that were damaged begin to receive the raw materials they need to repair. Step 6. Consider horse chestnut seed extract. A standardized extract containing 50 milligrams of ASIN twice daily has been validated in multiple controlled trials against compression therapy. It reduces venous tone deficiency, lowers capillary permeability, reduces leg swelling, and decreases the subjective pain and heaviness that makes this condition daily misery for so many people. This is not a folk remedy. This is documented. This is the Cochrane database, the gold standard of evidence synthesis, saying this works. Find a standardized extract from a quality manufacturer and take it consistently for at least 8 to 12 weeks before evaluating results. Step 7. Address intra-abdominal pressure. Drink a minimum of 64 to 80 ounces of water daily. Add fermented foods, sauerkraut, kimchi, kefir to support the gut microbiome that keeps transit time healthy. If constipation is chronic, the magnesium correction in step 4 will often resolve it within 2 weeks on its own. I want to be honest with you about timing, because this matters. You are not going to see a varicose vein disappear in 2 weeks. The existing damage, the dilated, twisted vein, is structural. It took years to form. But what changes much faster is the pain, the heaviness, the aching, the swelling at the end of the day. Those are inflammatory and fluid-related symptoms, and they respond to these interventions within 4 to 8 weeks in most cases. The structural improvement, actual changes to valve integrity and vein wall integrity, takes 3 to 6 months of consistent nutritional correction. And unlike the laser, unlike the sclerotherapy, unlike the compression stocking that does nothing but push blood around while the underlying failure continues, this correction addresses the reason the vein failed. Which means the adjacent veins do not simply pick up where the damaged one left off. You are changing the environment inside your vasculature, not just eliminating the evidence of damage while the damage continues. That is the difference between treating a symptom and addressing a cause. Your veins have been telling you something for years. What they are saying is not, you need surgery. What they are saying is that your vascular collagen is breaking down faster than your body can rebuild it. And the nutrients required to reverse that process are available, they are documented, and they are almost never discussed in the office where you were told to buy a compression stocking. Now you know. Here's what to do starting today. 1. Remove refined seed oils from your kitchen this week. Every bottle that says soybean, canola, corn, or sunflower oil goes out. 2. Eat whole citrus with the pith, dark berries, red onion, buckwheat if you can find it, every single day. 3. Start magnesium glycinate, 300 to 400 milligrams at night. 4. Reduce refined carbohydrates to under 50 grams daily. Bread, pasta, crackers, they have to go. 5. Add horse chestnut seed extract, standardized to 50 milligrams of ASIN, twice daily. 6. Drink enough water that constipation is no longer a daily problem. Do this consistently for 90 days. Your legs will tell you the difference before any test will. Now, varicose veins are one signal that something much larger is happening inside your vasculature. There is another video I put together that shows you what is happening inside your arteries at the same time, and what the one test is that your doctor almost never orders that would catch it 15 years before any symptom appears. I put that video right here. Watch it next.